Let's get more on Omicron and the developments around the world and speak to Jacob Glanville. He's an immunologist and founder of Centivax, an organization focused on new vaccine technologies. And he joins us now live from San Francisco in California. Hello to you. There was so much hope around this single-dose Johnson & Johnson vaccine. What does this latest news mean now for people that have had that particular vaccine?
So there were two things going against the Johnson & Johnson vaccine. One is that there has been this rare but very serious side effect of clots, which could be lethal. The second is that the Johnson & Johnson vaccine just wasn't as effective as the two RNA vaccines, the Moderna and Pfizer BioNTech vaccines. What this means going forward is certainly it's the case that there's a recommendation for boosting because a vaccination plus boosting is shown to provide enough antibodies to protect against Omicron. And for those who've received Johnson & Johnson so far, a number of studies have indicated that when you switch from a Johnson & Johnson initial shot to a boost by either of the RNA vaccines, that provides a substantial additional protection. So I suspect that will be the guidance going forward.
And it's very similar advice and a situation to the UK, where Pfizer and Moderna are being prioritized over AstraZeneca. I want to take you to Israel, where only Pfizer has been used. Is there something to say about only using Pfizer and also using it as a booster shot, given what we are seeing with the development of Omicron now there?
It appears that Pfizer and the Moderna vaccine both perform similarly. There are some advantages to the amount of antibodies produced with the Moderna vaccine, but if you've received Pfizer, you're in good shape to receive more Pfizer. The problem with Omicron is that it is so mutated that it's possible to still get infected even if you've received these vaccines. Now, booster shots, they turn up the volume on the antibodies that still work against the virus, but many of your antibodies don't work anymore. That means that it's highly recommended to get that vaccine to get boosted, but we're going to have to revisit in 3 to 6 months the degree to which that immunity has waned and maybe made the person more susceptible. The good news here is that even if the antibodies are partially compromised, there are other ways that your immune system is prepared, your T cells, that provide you protection from the severity of disease. So you may still get sick, but not as sick as if you were not vaccinated. And that's why everyone is being strongly encouraged to get vaccinated and boosted.
And there's been so much confusion about the severity of Omicron, the word milder being used a lot and also being criticized a lot by the WHO and by many immunologists. How severe is it in your opinion?
Yeah, so this is one where people want it to be more mild, and there were early indications and reports that it appeared mild when the first cases showed up, but those were in young people. And the real problem is that it takes 23 days from being infected to when patients start dying. So there simply hasn't been enough time for the first wave of Omicron to have had enough those people to have gotten sick, to reach a hospital, and then to see how many of them are dying. Over the next 2 weeks, we're going to learn a lot because the effect of that first wave is going to be evident. Now, the degree to which now in multiple nations, is this actually mild or not? Now, of course, that will be wonderful if that's the case, but it's premature to assume that, and we should operate, as you've seen many nations do, with the assumption that it is not more mild, and we should proceed with vaccination and reduce the spread of the virus until we can learn more about how it's going to affect our hospital systems and our health.
Thank you so much. A pleasure to speak to you, Dr. Jacob Glanville. Thank you.